Okay, this is a test of the meeting recording feature. I'm going to do a dry run of this talk and try to record it in 10 to 15 minutes since there's not going to be any Q&A. My name is Maurice and welcome to this career talk about the career opportunities for entry level in healthcare. And this talk will be focusing on the clinical support services. This is a part of growing healthcare organizations in which doctors are being onboarded by staff that can help navigate all of the credentials and contract documents related to signing a doctor up to work for a healthcare organization across state lines. I guess I should start off by saying healthcare is a very unique field to work in that it has lifelong career opportunities for every walk of life, every education level, and across geographic bounds all around the United States. Someone can come into a healthcare career with a high school diploma, college degree, advanced college degrees, masters of business or masters of science, or of course with medical expertise. People find lucrative healthcare opportunities if they have a mix of all of these. We've seen senior executives that have practiced medicine for 20 years stop practicing medicine, get a master's of business administration, and then go and lead a healthcare organization from the central office. We've seen people that have stopped out of college after a few years get lucrative healthcare opportunities by applying skills that they've learned in either IT or billing, English, or communications, marketing. There's so many places to apply critical skills in the field of healthcare to get life sustaining employment that gives you opportunities um, in Florida and all across the United States. I'm giving this talk because I believe that this is a place that people, especially minorities, are not always aware of. And in a time when people are looking for different economic vehicles, this is something that can use focus. And in particular, the audience that I've selected for this, I've chosen because I see particular skills in customer service, in the customer service arena, that could easily translate to jobs in healthcare. So I'm going to attempt to share my screen now, and we're going to look at one particular job called Clinical Support Services Specialist 1. And I'm hoping that the screen sharing will be able to capture that. Here we go. Screen sharing of screen 1, and we'll find out whether that records as I review this later. So at the company that I work now, Envision Healthcare, we use internal job boards to post listings company-wide so that our employees know first about different jobs that are available, and that our employees can then take any particular job and refer someone that they know. This is very common because most companies believe the best way to find good people is by asking the good people that you already have relationships with. Some companies are starting to look outside of that for various reasons that have the reasons is, they have their reasons, but this is still a really universal, ubiquitous way that you're seeing companies try to recruit people. We're going to zoom in on the particular job duties of a customer support, a clinical support services rep. And I'm not going to read them, but you'll see them here in the listing, and that's also available in the email. This particular job at Envision is a part of the team called Central Services, or Clinical Central Services. It's the operations that make sure we will have doctors going forward, um, because our company can't run without healthcare professionals. And there's so many things in the legal department, in credentialing and operations that have to happen for us to have doctors working. Doctors, of course, have to have licenses in the state that they're going to practice, and often a doctor might graduate from a medical school and get a license in the state that the school is in, and then apply for licensure in states where that doctor is going to practice. And it's important that we go to the different state agencies and websites and get copies of those licenses, have them on file, have them validated, so that when our legal department are offering contracts to those doctors to come and work, that they're actually eligible. Also, the way that doctors get paid really impacts the way that we have to onboard them. And onboarding refers to the whole process of hiring doctors. A doctor doesn't get paid like maybe you and me working a certain number of hours and getting a paycheck by the hour. They could get paid that way, but the company that's going to do the paying, like Envision, if we're going to pay our doctors, we're going to only be able to get money to do that, to make those payments, by billing an insurance company. So a doctor writes a medical report, has diagnosis codes on that report, submits those diagnosis codes to an insurance company, and the insurance company will pay. Well, guess what? Insurance companies are only going to pay doctors that are licensed. And if you can show that these doctors are licensed and legally practicing medicine. So before we can hire any doctor, before we can put them on payroll, before we can give them an account from the IT department, before they get an employee number, they've got to go through this lengthy, intensive process of credentialing. They've already done the work, they already have the licenses, but they don't necessarily keep track of them. That's why companies like Envision hire customer service reps to do a lot of that research, to find the things that we need to put in our databases so that we can make sure that we're legally authorizing our doctors to practice medicine in the communities that they're in. So this is a great way for someone with a high school diploma or some college to get their foot in the door in a medical field. It means that they know how to use a computer, they know how to talk to people, they know how to work flexibly around people's schedules if they have to ask doctors to meet with them, and be flexible to change the meeting date because the doctor's really busy. You want to have the type of personality where a busy professional would be comfortable talking to you. You know, respectful, polite. Um, Humor is always really good when working with busy professionals. It's not something that anyone can do. You know, you have to have certain people skills, and you have to be a self-starter, because there's so much work to do. There's just so many people doing it. A few managers and directors to lead small armies of people who are doing a lot of this research and gathering. So you have to be able to take a little bit of instruction, some guidance, and really hit the ground running. Um, this position, as well as lots of other positions at my company and others, um, are measured. We refer to that as metrics. We have methodology for keeping track on how productive a person is in any particular role, whether it's how many computers the IT guy fixes, or how many sales sales manager gets, or how many doctors a credentialing specialist gets credentials through the system, and what type of time frame people work on. So there's a performance-based bonus packages sometimes available for people that do their job really well, as well as disciplinary measures in this job and others for people that are not necessarily towing the company line, or taking care of things at a fast-paced way. So looking at my notes, I was also going to talk about how one might apply for a job like this. Well, if you were not referred by someone that already worked at the company, you might use job boards, career boards, to look at this and other careers if you knew the keywords, if you knew that the job was even out there. Envision is one company that in this space that does this and has a need for these type of staff, but some of the competitors in the environment are Mednax, company based in South Florida that does very similar services. Team Health, definitely up and coming company that is staffing medical professionals. And emerging into this space is a company I've worked with before called Modernizing Medicine, that do it in a more software driven way. As a matter of fact, that company was born out of a software company and kind of grew up to be more of a healthcare services company. But these are just a few of the companies that I'm familiar with. There are more, especially outside of the South Florida area. And I mentioned that to mention that the skills and the skill set in this particular job description are skills that are needed not just at one company, but at many. So it's worthwhile for someone interested in going into the healthcare field to be aware of this opportunity and others. How this is different than jobs that might use these skills outside of healthcare is if you were in retail doing some of these same things, you might not be compensated with a package that includes medical benefits or 401k package or vacation time. Working in the healthcare space, you feel like you're more part of a team, a professional organization that's really contributing to something good, something you can really feel proud of. Not that that's not the case with other fields, but for me, healthcare is a place that I always really felt at home. I could apply my IT skills in any number of disciplines, and at one time I did. I was working outside of healthcare, and I did not like it quite as much. I love working with doctors. I love working with the smart professionals that support doctors and help doctors do their job. And so this is a place that I've always been really comfortable. And I hope that anyone watching this video might feel the same way. There would have been a Q&A right here during the live meeting where we would answer any questions about this particular job description or how it fits in at Envision Healthcare or how this particular job fits in healthcare in general. But since this is a recorded session, we will not have that time for the Q&A. I could mention that one could apply for jobs like this either directly through the company site at Envision Health or by finding this type of job posted on other career-specific job boards like careerbuilders.com or monster.com. I first started in administration years ago by going through a third-party staffing firm. And to this day, a lot of staffing firms have contracts with the big players in healthcare to fill these types of job positions. The difference is if one comes in through a staffing firm, often they will be paid less than they would be paid if they worked directly for the company, and they might not have the benefits package, the paid days off, the healthcare, the 401k. These are perks that you get when you're onboarded as a full-on employee of the company instead of coming in through a staffing firm. But the benefit of the staffing firm is you might be able to try out this position at lots of different companies over a few years with a staffing company. So I definitely don't knock them. Many times during college, summer breaks or winter breaks, I've been able to get quick employment through a staffing firm and translate those skills and into working as a full-on employee later, because every time you get placed with a staffing firm, that's one more thing on your resume, and that looks really, really attractive over time. Okay, that's it for the recorded session. I'm going to go ahead and stop screen sharing now and conclude this part of the introduction to entry-level jobs in the healthcare field, specifically clinical customer service support. I'm Maurice. My email address is mgosby@gmail.com, and I'll be available to answer any questions about this for maybe the next 30 days. Then I'll forget I'll be on the other projects. I'm just kidding. All right. Bye-bye, you guys.